Good afternoon, everyone. Thank you for joining me at another episode of Back to Basics Practice Management and Operations. I am your host, Sharon Johnson, with Train 51 Healthcare Consulting. I am excited to have with me as a special guest Ann Angelucci from Premier Payroll Services, and we are going to be discussing all things payroll. She is very knowledgeable and an expert in that area. And I just wanted to give you a little bit of information about Anne. She graduated at Method University in Fayetteville, North Carolina. She earned her Bachelor's of Science in Business Administration. She also earned her Sales Mastery Sandler training. And she takes pride in helping small to medium sized business owners streamlining their payroll processing and navigating the continuously changing payroll and HR industry. Together with her team, she's able to achieve this by solving their specific needs and delivering tailored personalized support. She also spent time to cultivating relationships with referral partners such as CPAs, bookkeepers, benefit brokers, and insurance agents to ensure that when their clients are in the market for payroll and HR services, they immediately think of her and Premier Payroll Services. She has built trusting relationships with her referral partners so they can be confident that their clients and friends are in great hands with Premier Payroll Services. And just discussing with Anne, her knowledge base is really in depth, and I can't wait to dive into this conversation. And so let's go ahead and bring her on, and we are going to have a great information session. I hope that the tips that we share with you, you'll take with you after. And if you need anything, to contact Ann Angelucci in Premier Payroll Services. So without further ado, I'm going to bring her on. Hi, Ann. How are you?
Good. Hi, Sharon. Thanks for having me.
Thank you for being our guest. One of the things that in physician practices, whether you're new or established, and is payroll, right? We have staff that works for us. They are helping us to our efficiency in our practices, and payroll is just part of operations. And so for the independent physician practices out there, there is definitely a business side to this, and there's also part of where you have to pay for your staff. So a really good system in a payroll is something that is beneficial and something you want to get a look into. Having said that, what are your best practices for payroll management? Like, what would with someone that is newly looking to open a brand new practice, and they're looking to finalize all their checklist, right? They've got all the things that they need to check the box off, but what is the most important thing they need to make sure with payroll that they can talk with you, or what are some of the tips that you can advise them with? And then we're going to get to the second part of that question, which is an established practice that is looking to make a change or make a switch, whether they're expanding because they're going to scale, or they just acquired another practice to join their group, and then they've grown to scale that way. So the floor is yours.
Awesome. Well, thanks for having me. So, when you have a brand new business, regardless of what industry you're in, some best practices right out of the gate are partnering with a trusted provider that's going to help guide you and walk hand in hand with you as you set up your payroll for the very first time. So, something that Premier Now is doing with our clients is educating them on just how important it is for the business owner to understand their employer responsibilities when they go from maybe working in a practice to now owning the practice. So we like to take the time to guide them on, hey, these are the basic payroll responsibilities that you have as a new business owner. Then we walk through the appropriate documentation that you should have in place for each employee that you hire and why each of these forms are important. We want to share with these folks how important it is to pick a trusted payroll provider, how important it is to pick a trusted accountant, maybe even a bookkeeper. So we're all working on their behalf to help them streamline all of this behind the scenes so they can focus on growing their practice. it's also important to where we are located in the tri-state area that you're partnering with a provider that knows the state tax laws and what they are responsible for withholding per employee in each of the neighboring states that we border against, because it's very easy to operate in Pennsylvania and maybe employ some folks from Delaware or Maryland. Each of those have different taxes that need to be withheld and paid. So we are truly just partnering with the small business owner to make sure that they are armed and ready to get their practice going on the right foot so that they don't have to ever really make a change in a payroll provider again.
What are some of the innovative in terms of digital tools? I mean, we're living in a digital world, right? Right. We hear AI. We're also, there's electronic medical record, but there's also expansion of that in the way of their functionality. So, what are some of the automated systems that they can take a benefit and take advantage of? To again, it's just the easiness of being able to manage payroll, whether that's their practice manager or the both of them talking about what's needed for their staff in relationship to worked hours and just any payroll reports, things like that. Like what kind of automation is there?
Sure. So that's the name of the game right now. Is the trends we're seeing are streamlining, automated, and what that looks like from a technology standpoint these days is the payroll space has a software called a human resource information system. I make the analogy that it is a house where all your employee and payroll records are kept. Back in the day, they used a filing cabinet to keep these records. Now we're using an online cloud-based piece of technology where once we build out the infrastructure for your company, you can house all of your employee documents in there. So you're joining a practice, we can offer paperless onboarding. So we would work with the office manager or doctor and say, hey, what is needed for an employee to come join your practice? Maybe that's a W-4, an I-9. We need their direct deposit information. We may need some education certificates of their schooling and background and training. We may want to give them some company assets like a computer, a piece of technology, a uniform. So we want to make sure all of that data is gathered and kept in one safe and secure space. We want to then kind of talk to them about how are we going to keep track of employees' time, PTO policies. Time is actually the number one thing an employee can steal from their owner. So we want to make sure we're capturing time and attendance accurately and that those records are then feeding directly into payroll. We want to give employees the power to request time off when they want to take some time off, maybe look at their benefits. We want to integrate, maybe if the practice offers health insurance, we want to integrate the payroll into their benefit administrative system so that information can feed back and forth. When they grow and maybe put in a retirement plan, we want to offer to make those employer contributions on their behalf. Maybe they get set up with QuickBooks and they want their payroll exported into their QuickBooks automatically. From a bookkeeping standpoint, that may help the bookkeeper out. We want to offer all of these streamlined efficiencies so that the practice manager, doctor, whomever is in charge of this can go on and continue to work in their field and what they specialize at, and then leave it to us, their partner, to make sure that things are set up correctly in the background so that this all can be as seamless and as automated as possible.
Are there any reports that you recommend that they should, that the practice or practice manager wants to review with the owner, to just keep tabs of how how everything is going from the work hours, or let's say they're looking to hire another staff and they're kind of looking to see what hours they're going to provide with this, either an existing role or a new role.
Sure. So these HRIS systems have very robust report writers. So people can customize payroll reports based off of any information they're really looking to use. I also say a new business should get in the habit of, or really any business should get in the habit of looking at their payroll summary and getting in the habit of looking at what is this payroll going to cost me for this pay period? Not just the fee that the payroll provider is charging, but what's the payroll, what's the employer tax portion, and making sure from a budgeting standpoint that they always have that cash available to make payroll every week. Sometimes people don't check these reports and they get in a habit of processing payroll, and then it could be insufficient funds. And we just want to make sure that we're giving owners all the tools to know exactly where they stand with how much payroll is going to cost this pay period, just so they can make sure they can fund the operation of getting their employees paid, right? Because at the end of the day, if employees are not paid correctly, or if their taxes are not withheld and paid correctly, and most people think it's the federal tax that's miscalculated. It's really, in Pennsylvania, we have a local service tax or an income tax. And that came out in 2012, where it basically says your work location versus your home location, whichever tax is higher, that's what tax the owner is responsible for withholding and paying. So within our system, these tax codes are built right in. So the new employee comes in, uploads their information, feeds over to payroll. It automatically generates the appropriate tax that needs to be withheld and paid. And it's the smallest tax in the whole payroll taxes that need to be withheld, but it's the one that gets messed up the most. So making sure you're truly working with a partner that understands all payroll taxes from the highest government standpoint, all the way down, federal government, all the way down to your local municipality.
That's really interesting. I myself also got caught in that in some ways in the past, and the whole in Pennsylvania, that was really interesting with the highest and the low percentage between where you live and where you work. So that's a good nugget to know, particularly if you have workers that work still in Pennsylvania, but they might be in a different county, if you will. And I think
Yes.
that's really interesting to make sure to note. So that's a great tip. What are some of the like pitfalls or just things to keep in mind that they need to be a top of mind? That
Sure.
as the manager, as the owner, to just maybe it's a quarterly, maybe it's a monthly. You mentioned one about the reviewing the summary report so that they make sure they have their funds there, and then the taxes. What else is there that they need to keep their keep their eye on, just that at a purview to say, okay, I need to do this, I need to do this, I need to do this.
Sure. I think a couple things. I think having correct employee documentation when a new employee, whether it's an existing practice or you're a brand new startup, taking a look at all your employee documentation, making sure you have everything up to date. New W-4 came out a couple years ago, so just making sure that employees are filling out the correct W-4s, I-9s, verifying I-9 information, direct deposit. When you set up your workers' comp, make sure you have access to your workers' compensation reports. Those are typically never on a calendar year. They might be February to January. So making sure you're partnering with a company that can easily get you these reports. I just encourage people, sometimes new businesses listen to the chatter and they automatically think they need to conserve their resources and pick the cheapest option in this space. And without fail, we end up getting calls from folks that are using just a simple cloud-based technology, not matched with any real customer service of someone picking up the phone. So they're making these mistakes early on by picking the provider that's the cheapest, when really they need to pick the provider that's going to walk alongside them and help them as they grow their business, as they have questions, as they get letters from the different state, municipality, tax agencies. They really need to have someone to turn to say, hey, what does this mean? Do I disregard this? Do you add this to my account? What are they asking for here? Quick question, quick answer. Everyone goes back to their day. So we want to be as efficient as possible. And we also want to give practice managers and owners the ability to give their staff online access to their own records. So this comes in handy when an employee wants to view their pay stub. Maybe they're going to get a new car and the bank needs to see the last 3 payroll records, renting an apartment, getting a mortgage. anything you can think of where you need to show your own records, instead of the employee going to the owner saying, hey, can you print me out my last 3 pay stubs? We want to power the employees to have access to all of this. And we encourage all of our clients to have their employees activate their online self-service so they can make changes if they move, or they want to update their direct deposit, or they completed training and they can check the box that they completed the training, the CPR training that was, due 5 days ago. That way, the practice manager or the owner is not bothered with these questions that can really be a more self-service, and employees can have access to it at any time, 24/7, to their own records for whatever they should need them for.
And that's fantastic. I'm listening in terms of the digital tools. Is there like a just because I love data and is there a dashboard? Is there something that's like something that like a quick and dirty? But it sounds like you can also do a deep dive if you need to look for just in the information that you can also pull that as well.
Yes. So every payroll company needs a piece of technology to run the payroll and be the house that all the records are stored in. Premier Now is a network partner with iSolved. iSolved's a national payroll technology that can support employees from one. We support clients up to several hundred. And this platform is where all of the information lives, whether employers want to pull a quick report, make a change to their employee, ask a quick question. All of it's available, single sign-on, cloud-based. Anywhere you get the internet, you can have access to your own records and all of your own payroll information.
I really like what you're saying here because it's like a one-stop shop. And also, the other thing is that it can grow with you. So it sounds like if you're starting out as a startup small, and I say this, my disclaimer often is, your practice varies in size and scope and staffing resources, as well as, what technology you have. That having said that, so if you started out small and you're growing, the system grows with you. Is that what I'm hearing?
Absolutely. So I'll give you an example. If you are a brand new startup and you get introduced to me and you have 3 people that are starting on payroll, that could be very manual. That's very easy. Have these 3 staff members fill out these forms, send them back to me. My team will get this account set up for you. We'll show you how to process payroll. That's all you may need from us for the time being. Then you're all of a sudden buying another practice. You're adding new locations, maybe adding remote staff somewhere to help with your billing. That's when I would introduce the onboarding HR function where, okay, now we're hiring a lot. No one has time to be manually entering all this information into the system. Let's set up a link where your employees can go through a self-paced wizard to get their information on their own time into the system. Everything's customized to what exactly the practice needs from this employee to get on the payroll. Then maybe we talk about the time and attendance component of getting employees to clock in and clock out, whether it's on their tablet, on a desktop, on their smartphone, whatever their method of choice is. But that's a way of really capturing time that's actually worked, especially if you think of a practice having multiple locations. Every location may not have an office manager. They may all funnel to one, head,
Like a head.
one centralized location. So we're really starting to offer tools that are really going to help streamline and make the administrative process easier. Same with if they begin to offer a retirement plan. So in 2025, companies that have 10 or more employees who get a 401k are going to have to automatically enroll the employees right out of the gate versus them electing to be in the plan. They're going to have to opt out if they want to get out of the plan. So I can see us making more contributions on the employer's behalf with the companies that we integrate with, so they don't have to remember every pay period to log in and make their retirement contributions. And maybe one step further, they're now offering health insurance. So we are 360 integration with Employee Navigator, which is a benefit administrative tool where the benefits are in Employee Navigator. The employee makes their benefit changes. That lets payroll know a change is made. And similarly, if someone is terminated, they're in the system, the payroll system is terminated, that's going to then tell Employee Navigator that this employee is no longer working for us. So the more tools we're able to offer you as you grow and start to really have a need for something other than just payroll, taxes, direct deposit, we're also asked what we have to offer in terms of HR consulting.
Mm.
And at Premier Now, we have a lot of great local partnerships with HR consulting firms around the area who we feel super confident sending to our clients if they need help putting a handbook in place, if they need help with job descriptions, how to effectively terminate, hire, leadership training, any and everything. We have a resource that we could help point our clients in the right direction to.
That's fantastic. So it's a suite of cadre, but also it grows with you. If you start out small, you grow to scale, and it's the opposite though. If they're downsizing, and at some point going to be in full retirement, I imagine you have the process also to kind of do the reverse versus just yeah.
Absolutely. You can scale down at any time. And we treat our one-person clients the same as we treat our 500 employee clients. Everyone's treated the exact same. Everyone has that best-in-class service out of our office in Royersford. So if maybe you were utilizing something and it's not something you need anymore, we
Mhm.
could turn that off for you. We could bring you right back to just basic payroll, taxes, and direct deposit. But happy to help if you're going the opposite direction and in growth mode, providing these additional services that people may not think about when they think about picking a payroll provider. Another one I forgot to mention is people have a challenge in hiring right now. So there's a module we offer called Attract and Hire, where we are linking to different job boards for our clients and getting a feel for exactly what they're looking for in their next candidate. A lot of our clients know Indeed, they've seen Indeed, they throw money at Indeed, but they don't really are sure what their return on their investment is. So we're dialing down, getting an idea of who they're looking to hire, where this person ideally should live, that it makes sense to hire somebody. And really just helping the owner have a well-rounded solution aside from just payroll. Payroll's a commodity. We're not a commodity. We're a true solution to a small and medium-sized business owner who's looking for a partner with all of this back end, I don't want to call it minutia, but really back office administrative tasks that are non-revenue generating to a business owner.
Yet it's important in the way that
Very.
operations and the cog of the wheel that makes it turn. And from what I'm hearing, the part that from a business owner standpoint is the HR component along with the payroll. It serves to help make that decision of how we want to allocate our staffing resources to be able to look at, and then also it helps with budgeting as well, because then you are able to see it in one suite, which is nice to have, because sometimes when you have multiple suites doesn't necessarily mean you log in, you log out, you go in and you go in different kind of systems. Having it in one, to be able to see it in one, is a nice streamlined feature, because then you're not really going out for any other reason other than staying in the module that is specific to the practice manager or the owner, to be able to have that conversation. That's neat. I'm a very much a digital tool person. Along with data analytics, and I think that what I'm hearing is that you get a bit of both. That you get the best of both worlds, and you can maximize how you're handling that part of operations. But there's a little bit more extra that should you need an HR component, should you need something else in terms of that, there's a part, there's a piece that they can actually work on.
Absolutely.
What's the best way to reach you? How do how would you, if a business owner came to you guys, what's your process? From there, kind of, and educating them, and helping them get to the decision that they need to get to, make payroll efficient and so forth.
Sure. So we can be reached. I could be reached on my cell phone, my email, our company website, LinkedIn, across the social platforms. And also, when I get an introduction to a new business owner, regardless of the space you're in. We're simply having a friendly conversation of what you're looking for, what you may not know. We're going through a bunch of solutions to see if they make sense for your company, for your budget, for your size, and just kind of sharing more about what being a local payroll provider looks like in a world where you have a lot of big national players and then you have a lot of online do it yourself players arising. So, really honing in on what the partnership looks like with another business that's probably very similar to yours. We're a company of 20 employees and been around 25 years. So, we're that true definition of small to medium, whichever way you want to classify it, business, just looking to partner with other good businesses in the area that value the knowledge and resources that we're going to help you out with. But just having a basic conversation to see if we're the right fit for each other. I'll give you the lay of the land of what you're in store for based off of the last 15 years of working with different medical practices across the board. I see the same patterns. I see someone that recently graduated from med dental optometry school. They buy an existing business that's been in business for 30, 40 years. They're unsure of how things were set up previously. So we kind of take a look at how we can streamline and automate things with current day modern technology processes. And yes, everyone likes the tech, but the small business owner, we believe, still appreciates the handholding and talking to someone local in an office that's going to help support them. So you really get the best of both worlds. You're going to get a piece of technology that can help you with what you need, matched by the service that our office and team are providing our 2,000 clients. And it's just a really casual conversation of this is what we can help you with. I have a little menu of services. We could talk about them. We could start small. We can grow with you. It's really me just giving you the total scope of what you're really in store for and what your responsibilities are as a business owner. I pretty much do know for a fact that most people coming out of med and dental and optometry school were not taking business classes. So I feel fortunate enough to be able to be pretty knowledgeable in this space to be able to educate you on, hey, this is what you're in store for. This is what employer taxes mean to having a business in this country. This is what you have to do once you withhold all these taxes. These are the records you should keep on your employees. When they're buying an existing practice, I'm kind of like, we're going to clean house a little bit with records and just make sure all records are up to date and we have what we need to stay compliant. No more, no less. Just let's make sure we have everything up to date. And I just feel that the owner feels a little more powerful knowing that they now understand what they're in store for, because I don't think this is talked about prior to buying the business. They know they're going to have to do this, but I don't think they actually understood what this really means.
Understood. And I think that's, and I'm glad that there's also a person next that they can call, because sometimes there are things that just requires phone call, that you need another human to be able to interact and get the questions that and the answers that you need. So the other thing I wanted to ask is that, we talked about downsizing, but in succession planning. So if you've been with them for X amount of years as the payroll service provider, and now they feel that, okay, I'm ready to retire, go on, kind of do something else in the next chapter. Are you guys part of also in that succession planning with them? Because we're now kind of we're now ready to downsize or sell in that case.
Sure. So I can be. I have been part of this equation. I've also not been part of this equation. So I've been part of the equation where the business owner will email me and say, hey, can I have, or can you show me how to find X amount of years of reporting? I need to show what I'm paying in wages, what my payroll is to the owner that's looking to purchase my business.
Mhm.
So I help in that regard. And then I also feel that I want to have such a great relationship with this partner that they say, hey, Dr. Smith, when you buy this business, we use this payroll provider that has been nothing but wonderful and helpful to us. Here's here's Ann. She'll be happy to transition all of this existing information to your company. That's the ideal case scenario is I worked with the owner. I'm going to work with the new owner. And then behind the scenes, we're just taking the documentation under one business EIN number and moving it to another EIN number, because what we don't want to have is disruption when a practice is being sold. We don't want employees being surprised by the acquisition or the sale. We want to ensure employees that they're still going to get paid in the same frequency, in the same manner that they were before, because your employees are your biggest asset. So we need to make sure everyone's happy, knows what's going on, knows that they can expect their paycheck next Friday as if Dr. Joe is still working here. So I love being a part of that transaction, but we can also pull them any reporting that they may need to show when they're gathering their records for a purchase.
That's wonderful because sometimes, I think we fall below the succession planning at times, and things that I just think of in terms of the back operations that are also crucial. I do think that the payroll service provider needs to know that if there's an acquisition and there's a transition or there's a change in that magnitude in the way that the plan is not, going to be followed. I think that that's also another important conversation to have. I think,
Yeah.
yeah.
And I think what happens also on the flip side of this is where this has happened to us also is I get an introduction to a practice and they say, I just want to keep everything as is, which is great. However, no one's coming back in to educate the new owner.
Mm,
So that's when I'm kind of like, yes, I agree with you that we want to keep things as calm and the same as possible, but I can help do that, but also educate you on what you're in store for and maybe partnering with me. I'm not going to let this be disruptive. I'm going to do it so seamlessly behind the scenes that your employees are just going to see that they were paid from one payroll company last Friday and they're paid from a new payroll company this Friday. Nothing else is going to happen to cause
right.
any disruption. So I do just think it's so important for the business owner to truly understand what they're paying a payroll company to do. Take the hour conversation with me to understand what you're in store for. And then you probably never have to have this conversation again and you can palm me off to an office manager, but at least know what you're now responsible for when you own the business.
Understood. I love the tips that you just shared with us. I do think that they're very practical in the way that, taking the time to understand your responsibility as a business owner. There is a business side to medicine, and not just patient care. And I do think that taking that time gives you, information and arm you with a better state of decision making if you don't have it already,
Correct.
delegated to another a bigger administration or a bigger thing. But I think at the very least, where you sit in this small and mid-size, you have to be involved in some conversation or process to be informed.
Because the majority of practices don't necessarily have an office manager. I mean, this is a lot of nighttime, after hours, weekend work that's being done where the days of a family member is not working with you anymore. Your wife is not your admin, your bookkeeper, your accountant. She's got her career, you have yours, and you are kind of doing all these administrative tasks at night or when you're not seeing patients. So it's, might as well get this streamlined and set up correctly right in the beginning. So it's kind of like set it and forget it. And then use us if you need additional resources.
Understood. Well, I thank you so much for coming. I learned a lot actually, and I hope that our practices out there listening that they would take advantage of the information. And if they want to reach you, I'm going to actually follow up from this our LinkedIn Live, put in your information in the comments if they need to
Awesome.
reach you, and that just have the conversation and see where it goes from here. And I think that
Exactly. See if you're just doing the right things and have the right things in place. And I'll tell you yes if you do. And if you don't, I'll suggest how we get you there.
exactly right. Well, thank you so much. Thanks for being our special guest, and
Thank
looking
you.
forward to another episode of Back to Basics Practice Management. And again, thank you. I so appreciate the discussion and the
Thank you.